Rynex Dm is a combination medication used to treat symptoms caused by the common cold, flu, allergies, hay fever, or other breathing illnesses such as sinusitis and bronchitis. It contains dextromethorphan, which helps suppress coughing, and decongestants to relieve a stuffy nose. It also includes antihistamines to relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. It's important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years old. Some products, like long-acting tablets/capsules, are not recommended for use in children younger than 12 years. It's best to consult with a doctor or pharmacist for more details about using the product safely. Rynex Dm does not cure or shorten the length of the common cold and may cause serious side effects if not used correctly. It's crucial to carefully follow all dosage directions and avoid using the product to make a child sleepy. Additionally, avoid giving other cough and cold medication that might contain the same or similar ingredients without consulting a doctor or pharmacist first. Lastly, it's essential to ask the doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or using saline nose drops/spray. When taking Rynex Dm, be sure to carefully follow the directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, take it as directed. Take this medication by mouth with a full glass of water, with or without food, as directed by your doctor. If you are using the liquid form, be sure to use a medication measuring device to carefully measure the prescribed dose. Do not use a household spoon. If you are taking the extended-release capsules, swallow them whole. Do not crush or chew extended-release capsules or tablets. If you are taking the powder form, mix it thoroughly in the proper amount of liquid and drink all of the liquid right away. Do not prepare a supply for future use. The dosage is based on your age, medical condition, and response to therapy. If you are taking this medication for allergy or hay fever symptoms, take it regularly to get the most benefit from it. It is important not to increase your dose, take it more often, or use it for a longer time than directed. If your condition lasts or gets worse, be sure to tell your doctor. If you experience drowsiness, dizziness, headache, blurred vision, upset stomach, nausea, constipation, or dry mouth/nose/throat, be sure to notify your doctor or pharmacist. To relieve dry mouth, you can suck on sugarless, hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. It's important to drink plenty of fluids unless otherwise directed by your doctor to prevent the medication from drying up and thickening mucus in your lungs, which can make it more difficult to breathe and clear your lungs. To reduce the risk of dizziness and lightheadedness, it's recommended to get up slowly when rising from a sitting or lying position. If you experience any serious side effects such as mental/mood changes, ringing in the ears, shaking, trouble urinating, weakness, easy bruising/bleeding, fast/slow/irregular heartbeat, or seizure, be sure to tell your doctor right away. While a very serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. Remember that this is not a complete list of possible side effects, so if you notice any other effects, it's best to contact your doctor or pharmacist. Before taking Rynex Dm, it's important to talk to your doctor or pharmacist if you have any allergies or medical conditions. This medication may cause dizziness, drowsiness, or blurred vision, especially if you consume alcohol or marijuana. It's important to avoid driving or using machinery until you know how the medication affects you. If you have phenylketonuria, PKU, or other conditions that require you to restrict aspartame, consult your doctor. Liquid preparations of Rynex Dm may contain sugar and/or alcohol, so be cautious if you have diabetes, alcohol dependence, or liver disease. Before having surgery, make sure to inform your doctor about all the medications you are using. Older adults and children may be more sensitive to the side effects of this medication, so it's important to monitor them closely. If you are pregnant or breastfeeding, consult your doctor before using Rynex Dm. It's important to be aware of potential drug interactions with Rynex Dm, as they could affect how the medication works or increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Taking certain MAO inhibitors with Rynex Dm could cause a serious and possibly fatal drug interaction. It's important to avoid taking specific medications during treatment with Rynex Dm, and most MAO inhibitors should not be taken for 2 weeks before and after treatment with this medication. Be sure to consult your doctor for specific instructions. There are also other products that may interact with Rynex Dm, such as antihistamines applied to the skin and rolapitant. It's important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, as this medication may also cause drowsiness. Be sure to check the labels on all your medicines, as they may contain ingredients that cause drowsiness, and ask your pharmacist about using those products safely. Additionally, Rynex Dm may interfere with certain medical or lab tests, potentially causing false results. Make sure that lab personnel and all your doctors are aware that you are using this medication. If you or someone else has taken too much Rynex Dm and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents should call their provincial poison control center. Symptoms of overdose may include agitation, confusion, flushing, hallucinations, dilated pupils, muscle twitching, and seizures. In children, they may initially show excitement followed by coordination issues, drowsiness, loss of consciousness, and seizures. If your doctor has prescribed Rynex Dm, do not share it with others. It is important to keep all medical and lab appointments while taking this medication. If you are taking Rynex Dm on a regular schedule and you happen to miss a dose, take it as soon as you remember. However, if it is close to the time of your next scheduled dose, then it's better to just skip the missed dose. Just continue with your regular dosing schedule, and do not take a double dose to make up for the missed one. It is important to follow the recommended dosing instructions for Rynex Dm to ensure its effectiveness. When storing Rynex Dm, make sure to keep it at room temperature and away from light and moisture. It's best to avoid storing it in the bathroom and refrain from freezing the liquid forms of this medication. And as always, make sure to keep all medications out of reach of children and pets. When it comes to disposing of Rynex Dm, it's important to not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, make sure to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.